Hello and welcome. Thanks for staying with us here on India Today and welcome to this special broadcast. SARS-CoV-2, the virus that looks like a spiky ball under a microscope, is still around. And humans across the globe have to now make peace with this new reality. Over the next half hour, we bring you a special report on how we can live with this virus. As Lockdown 4.0 nears its end, what is Lockdown 5.0 going to look like? What is going to be open? What is going to remain shut? That's the question on everyone's mind as the pandemic continues to spread across the country. Here's a look.
First, the fear of getting infected by the virus, then the loneliness of waiting out a lockdown away from loved ones, away from places people hold dear, and away from places which the faithful believe in. For more than 2 months, spaces of community worship lay empty, bereft of followers, while a microscopic devil haunted the land of the living. Now, as India gears up to enter Lockdown 5.0, many look forward to the reopening of these shrines. Centuries-old places are now preparing to host devotees once again. Even modern temples of consumerism, the malls, gyms and salons, which sat vacant and uninhabited till now, begin preparations to host their patrons soon. But the virus is here to stay. That is the new reality. So as the world inches its way back to routine, will it go back to its old conventions? Or will it usher in a new normal?
In India, as elsewhere as well, the lockdown has been eased, but it has also been extended. And the reality is, India and the world will have to learn with the coronavirus. So how do we do that? What changes for us? And what really becomes the new normal? Here's a look.
As individuals head back into their communities under a new reality, there is no avoiding the fact that the virus is here to stay. A return to crowded spaces and collective experiences is still a long way away. Life, as it was when 2020 began, wouldn't be the same. So there is a new normal. No, that doesn't mean everyone becomes a hermit and gives up the charms of worldly pleasures. But there are a few things one should know about how, when and where the virus spreads. Data shows that successful infection is a combination of exposure to virus load over a period of time. So be aware, take precautions, don't drop the guard. Patient data also shows people are infectious for a few days before they develop symptoms and for a few days after symptoms start. So one can look and feel perfectly healthy and yet spread COVID-19. So coughing and sneezing aren't the only red flags. Talking loudly, singing, shouting, all release droplets potentially loaded with the virus. Touching contaminated surfaces also pose as potential route for the transmission of COVID-19. Epidemiologists analyze data from different countries to see where people caught the virus. And a staggeringly high number of cases show the contagion took place indoors rather than out in the open. The top 5 places where people contracted the infection are home, when someone within the family falls sick, workplaces, especially when office environments are enclosed spaces with poor air circulation and high density of people. Like in the case of a South Korea call center that became a super spreader. Over the space of a week, 94 of the 216 people working on the same floor of a high-rise building came down with COVID-19. Most of them worked on the same side of the building. The desks of those who got COVID-19 are shown in blue. Experts believe the recycled air, high density of people, but mostly all that talking by the call center employees helped transmit the virus faster. Social gatherings, birthday or wedding parties, funerals and religious gatherings have been responsible for a broader chunk of transmission across countries. Public transport, multiple high-touch surfaces and high density of people makes this a perfect ground for community transmission. Restaurants or bars, another enclosed space with multiple high-touch areas and usually filled with people closely spaced together, talking loudly, which results in more saliva droplets in the air. Studying a cluster in China's Guangzhou, experts concluded infectious droplet transmission was prompted by air-conditioned ventilation. What's common in all five is that all of them are indoor with recycled air and lots of people. So how is the world gearing up to face these new realities?
Social distancing norms are the guidelines that will be provided by the authorities will naturally change the way India goes out and drinks, goes out and parties, and goes outside and eat. I think people will initially be a little tepid, there'll be a little bit of wariness, but Indians are naturally very, very optimistic people. We're optimistic to a fault. We love going out. Eating out is the #1 form of entertainment for most Indians across the country. It's gonna happen. It's gonna pick up fairly quickly, but for the next 6 to 8 months, we can assume that things are going to be tepid, things are going to be wary, things are going to be slow. People will go out where people feel safe.
Sales are not down a little, they're zero, and fixed costs continue. So we're really hoping that the government will allow us to open up and let us do what we're best at, which is going out and pampering all of you. The first thing that we're going to do is make sure that we win back the trust around hygiene and safety, because that is of paramount importance. So all the protocols, all the SOPs are in place. We're going to make sure that it is an oasis of comfort. It's an oasis. It's a 60-minute holiday for you guys. And it's a safe place to be with social distancing, but with your favorite beverage or with your favorite food surrounded and with smiles around you.
People in India love going to movies and all different theatre plays and everything. That will continue. We are going paperless tickets. So where a person used to come and get a physical ticket, now we will not have a physical ticket. We will have a paperless entry. We have a lot of cinemas where we had open entries. Now all that open entries will stop. There will be difference of timings for each shows, which will ensure that the gathering is not happening at the lobby.
Real challenge will be in the labor-intense industries and factories. They will have to balance between cost cutting and also making staggered working shifts, which will not be very easy. And on top of that, several states have suspended the labor laws, which will mean that the workforce will have less immunities than they had earlier. But more importantly, the Indian labor force, the massive labor force, is in the informal sector where there are no rules. So who will frame the rules for them to protect them from the coronavirus? They already have to work in huge shifts where a lot of people work together. There is hardly any social distancing. And the tussle between hunger and the fear of an unknown ailment, coupled with misinformation, that make the situation even more complicated.
So the grocery store one visits isn't the space one needs to fret over. And no, a quick workout in the park isn't as dangerous, as long as one maintains physical distance and takes precautions. But it is time to rethink social lives. Replace the hug and handshake with other non-contact greetings. Replace big parties with more intimate lunches for close friends and family. Outdoor areas would be preferred over indoor enclosed spaces for gatherings. Technology will still be used to connect with loved ones, especially those at high risk. And consumption patterns, be it a clothes shopping spree or jet-setting around the world, may change. As people move back out more freely, remember the risks. So keep that mask on, wash your hands regularly, and stop touching your face.
While the government's latest lockdown mantra focuses on learning to live with the virus, there are still many who just cannot afford to let down their guards. The country's senior citizens, for example, and those who might be above 60 or not be above 60 as well, but are living with an impaired immune system. Up next, we focus on how the pandemic and the latest lockdown rules affect older adults and those with comorbidities.
When COVID-19 pandemic took hold of the world, everyone was shunted in. But now as the world eases its lockdown measures, two demographics have no choice but to continue to stay in. Because without a vaccine or cure in sight, the elderly and those who are not so old but immunocompromised remain in peril.
They are definitely at a much higher risk of acquiring COVID-19 as well as at a higher risk of dying from it. So they have to take special precautions. It is advisable that they should stay indoors as much as possible.
So we asked medical professionals, how can those with a compromised immune system navigate a future where the virus still exists?
You can meet your children, your grandchildren, but as far as possible, wear masks before you meet them and maintain a 3 to 6 feet distance wherever possible.
The time spent within the hospital also should be minimum. They must request for an appointment at a time when the crowd is less and the waiting time is also less. The number of hospital visits should be minimized.
Meeting people, having gatherings, going into the crowd, starting your weekly meetings where you are playing cards or attending even shorter group of meetings. Avoid them for some time, even if you are wearing a mask.
To boost immunity, they must maintain their healthy lifestyle, continue to do exercises as much as possible, and maintain a healthy diet. They must include some vitamin supplements, also include ginger, lemon, honey, all these things in their diet. These are substances known to boost the immunity.
The aged are at a greater risk and they need to take more precautions than those with higher levels of immunity. But medical professionals feel that it is equally important, if not more important, to maintain the emotional and psychological balance of the aged and the infirm, because better mental health leads to being able to better adjust to these trying times. Many believe the mass unemployment, depleted social safety nets, starvation, increase in gender-based violence, homelessness, alcoholism, loan defaults, and millions slipping into poverty due to the pandemic will all add up.
4,500 people have died of corona since the beginning of this epidemic. This is a very significant number, but just out of context, about 500,000 people die each year of TB in India. Now you see, for a population that is accustomed to people dying of a whole range of different infectious diseases, you can well imagine that the very act of locking down the whole nation in 4 hours must have instilled, even without saying anything, instilled an enormous sense of anxiety that what we are facing now is far more lethal than any other bug or disease that we've encountered before. And it's therefore quite natural for people to react with enormous fear. And a lot of that has to do with very poorly crafted communication and information about the dangers that the virus poses. And you can see some of the tragic consequences of that, for example, in the way doctors, health workers, and people returning back to their villages are being stigmatized and discriminated against.
Experts across the globe have warned of an upcoming surge in the number of people showing signs of clinical anxiety, depression, and other mental health issues. The World Health Organization pegged India's suicide rate higher than that of the global average. In 2018, India reported 1,34,516 suicides, but most independent estimates show that the numbers are underreported. And adults aren't the only ones. the parameters for children and young people isolated from friends and school are equally grim.
Young people today, their entire lives have been thrown under the bus. Their education has come to an end. Their job market has evaporated. And this is the age group which has the highest suicide rates in India. Suicide is the #1 killer in Indians aged between the ages of 18 and 35. Now, think about that. This is the age group that we should be really paying a lot of attention to. We don't hear anyone talking about young people's well-being, and I am really concerned about it more than probably any other in our country.
We have seen in the past that similar cases of economic crisis have increased the number of people with mental health issues, leading to high rates of suicide, for example, due to the mental health condition or the substance abuse, for example.
In the US, the COVID-19 death toll has crossed 1 lakh, and the coronavirus pandemic is having a devastating effect on Americans' mental health as well. According to the new Census Bureau data, a third of the population is showing signs of clinical anxiety or depression. Globally, healthcare workers who are seeing thousands of patients infected with and dying from the coronavirus are also deemed as high risk of facing mental health trauma. Recently, the United Nations urged countries and policymakers to redress historic underinvestment in mental health services and work proactively with anxiety-afflicted populations in the days to come.
We're stepping into a very short commercial break here on India Today. There's lots more coming up on the other side, so stay with us. Welcome back. Thanks for staying with us on India Today. While doctors, scientists, epidemiologists and governments are all doing their best to give the right advice to the people, they aren't the only ones. There are many artists across the world who are helping people decode the science and understand the virus and its patterns better. Here's a report.
As the world eases out of its cocoon after almost a month of being confined indoors, it is important to know the do's and don'ts of living with the coronavirus. But scientific data and doctors' advice can often be confusing for many. But illustrations like these help people understand which social situations to avoid and which to go ahead with in this new reality. Created by Toby Morris in collaboration with Dr. Wiles, a microbiologist, and published in an online magazine from New Zealand, The Spin-Off. The animated illustrations have simple explainers, like how to figure out your symptoms, or why must one wear masks and how to handle them.
So that people who wore them thinking they were protecting themselves would understand that actually that didn't make them invincible, and that they had to wear them properly, and that they were doing it as an act to help protect others. And it only really works well when everybody does that. So these are the kinds of things, the kinds of concepts I've been trying to explain in the graphics, that Toby's beautiful, his beautiful illustrations are what bring those to life and what help people connect with them.
Or explaining in depth why it is important to continue maintaining physical distancing, and more importantly, the repercussions of making the distancing norm. Some of the scientific language is a bit different to common usage. Dr. Wiles and Morris laid that out simply.
I'm a scientist, but I've had a long-standing interest in communicating science. So we were thinking of things that would be shareable on social media, because actually, while I write big explainers about the pieces. What we really needed was things where people could really quickly understand the concept and how, you know, what their actions needed to be. And so the kind of animated, the short animated GIFs, they were the things that I guess seemed like the best fit.
There are other microbiologists helping the world understand the science and decode the data. Dr. Erin Bromage's blog post explaining how coronavirus spreads and what people can do to keep safe has been viewed more than 13 million times. An associate professor in a US university, Dr. Bromage simplified the data from various disease control centers across the world to explain where lies the risk and how to avoid them. Others, like renowned virologist Ian Lipkin, gave a simple list of do's and don'ts.
Most people want to go into work is that they want to have an opportunity to interact with their colleagues. To do this, you need to bear in mind the same rules we've had already for minimizing risk. The 2-meter distance between people in a conference room, for example, wearing masks. All of these things will be enormously helpful and will allow you to have conferences. And I'm eager to travel. If one were to go on a flight at this point, I think there are certain measures that you should take. We know that the virus entry is through a mucous membrane. That means the mouth, the nose, or the eyes. So if I were flying, number one, if I couldn't ensure that I had a certain amount of distance between me and other people, I would wear a mask, I would wear goggles, and I would wear gloves. That is the safest way to travel.
And India, government websites give out simplified instructions in vernacular languages and even sign language.
And now let's look at what the experts have to say as we move forward. Here's a look.
Important for every district to actually report not the state level data, but actually what's happening in your district. You know, Maharashtra is a huge state. There's huge variation in Maharashtra, and we can already see that. So follow the information on what is happening in your state. You know, one of the curious things, Rajdeep, is no matter where you go in the world, the actual trajectory of the epidemic looks extremely similar. Between 6 to 12 weeks, the epidemic gradually wanes out and completely disappears. There might be a second wave, but we haven't seen one yet so far. And so what we really need to do is to see where we are on that curve.
As you open the lockdown, you need to test, you need to be able to isolate and quarantine and contact trace, so trace contacts. And number 3, you need, I would say, as universal facial masking with the highest grade masks available or possible to be able to do this. The main thing that we want is to buy time for ourselves until we get a good drug, vaccine, or drug candidate. So if everyone can pitch in and buy us time, there are drugs coming. There is hope at this end of this tunnel. There are drugs coming. The vaccine will be there. There will be effective medicines. So just buy us time by preventing the spread of virus and deaths. That is everyone's job as a public citizen.
There will be people who will be immune to the virus. And although the antibody tests are really not yet reliable, they will be soon. And then you will be able to identify people who are truly immune, who don't have to worry about becoming reinfected, and who presumably cannot become people who are capable of transmitting disease. So there will be options, I think, to improve the amount of socialization we have as we move forward.
You know, we're seeing international collaborations probably on a scale never done before, really, and at a speed never done before. So I believe there are many, many different types of vaccines that are being kind of developed. There are many different drugs being trialed. There are hundreds of trials going on around the world. And I guess what's really important is that we do these things while we're trying to do them fast. They're done so that we get safe and effective vaccines and drugs.
About a total of 30 groups in India, big industry to individual academics, who are trying to develop vaccines. of which about 20-ish are keeping a good pace. Yet, this is a very competitive area.
That's it from me, Chaiti Narula, on this special broadcast. Thanks for tuning in. Thanks for your time. You stay home, stay alive. That's most important.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.